Good morning. I'm so very glad to be here with you to present my story. Normally, I'm here in person and have been doing so about the last 12 years. But when you guys are watching this, I will be attending the National Turner Syndrome Society's annual conference in Orlando, Florida. My name is Cindy Kenward, and I was born July 3rd, 1961, on Long Island, New York. I was diagnosed with Turner syndrome at the age of 17 in 1978. They started me on the highest dose of estrogen, Premarin, at that time, and I took it days 1 through 28. And I also took progestin, or Provera, from days 22 through days 28. I have been married since Valentine's Day. Everybody say, ah, 1988 to my husband, Paul. And we chose to build our family through adoption. And our daughter, Elizabeth, we call her Beth, came home to us at the age of 7 weeks in January of 1998. She is now 26 years old. If you're wondering how I even got here, it was because of your very own Dr. Naines. I worked with him at the VA Medical Center around the corner. And one day when we were walking out of a meeting, like I said, about 12 years ago, he asked me if I would be interested in talking to the medical students at Emory. Obviously, I said, heck yeah. During this lecture, you have learned of numerous features in Turner syndrome. This is a picture of me and my siblings about 1962. I think part of the reason I was diagnosed so late is I didn't have a lot of the features that have been described in this past hour. For example, I did not have the edema that so many Turner women have. As you I'm sure have noticed, I was born with bilateral strabismus. Chronic ear infections right up through college were also a norm for me. That is why at age 50, I required the use of hearing aids. I'll go into more healthcare issues in a bit. I wanted to talk to you a little bit about how Turner syndrome has affected my personal health. Basically, I consider myself pretty healthy. I exercise regularly and I'm out there all the time walking. You've seen a picture of me as a baby with bilateral strabismus. That was surgically corrected in 1962. I was in around 1.5, 2 years old. The right eye slipped back. They tried to patch it. They tried to do things to help align it without any surgical intervention, and it really didn't work. At age 20, I wanted to have it corrected for cosmetic reasons. This was in 1981. Since it had been misaligned so long, it resulted in strabismic amblyopia. So I have about 2200 vision in that right eye. So I can see, but I can't see anything fine motor skills, threading a needle, anything like that. I grew up with chronic ear infections, and at the age of 30 in 1991, I had a tympanomastoidectomy. And it was the result of, they finally found a cholesteatoma. And while they were in there, they put in some prostheses because the bones had been damaged from the cholesteatoma. And then it worked for a while, but at age 50, I finally needed hearing aids. My thyroid. I was diagnosed with Hashimoto's thyroiditis at age 31 in 1992. Cardiac. I had the Bentall procedure done at age 50 in December of 2011. The Bentall procedure replaces my aortic valve and aortic root. Now, even though I was age 50, it was a pediatric cardiothoracic surgeon that did it. And I believe this is because the condition is congenital. Bone density. I do have osteopenia. I am on Boniva, and I have to have regular bone densities done every 2 years or so. I have broken my left wrist 3 times at age 12, 17, and 35. Now, the repair the last time was surgical. It lasted for a while, and then the metal plate that they had put in actually ruptured some tendons. So I ended up needing to go back for surgery to do a tendon transfer. And they did a lot of surgery on this. You can see this finger is still mangled a little bit. I mean, I can bend it, but that's a result. And I'm not complaining. I'm glad I can use the hand. Social issues in school. I did pretty okay in school. I had friends. I didn't miss any milestones as far as my prom and things like this. I had a math deficit, and this is from elementary school. I've always had a rough time with math. I tried my best to keep up, and I did take the regular math. But then they also supplemented it with a special math book that kind of helped. They didn't have IEPs and stuff like that in 1969, 1970. And this seems to be a common theme with Turner women due to visual spatial issues, which affects math, apparently. I don't like to use my height as a crutch. I am 4'10", and I really think it has biased people's perception of my abilities and my aptitude. I forgot to mention when I was talking to you about taking Premarin, you knew I was 17. Well, that means I'm a senior in high school. That means my body hadn't been exposed to estrogen until I was 17. That means I was hitting puberty at age 17, my senior year of high school, when all my friends had done it late elementary or in middle school. So that was very interesting. I don't recall it being traumatic. And I'll tell you a funny story. I wish I could be with you in person. Taking the Premarin and Provera results in having your period. So, I mean, the first 30 days, I got my first period, and here I am 17 years old. Honestly, I felt more like a woman. Right or wrong, that's how I personally felt. After I got the first one, I said, okay, I've been there and done that. I don't need to do this again. You can all laugh now. Ha, ha, ha. Thanks a lot. I'll keep moving. I wanted to talk a little bit about my education and career. My undergraduate degree was obtained at Wagner College on Staten Island, New York in 1983. I majored in medical technology, laboratory science, and bacteriology, microbiology. My graduate degree was obtained here in Atlanta at Mercer University in 2001. It's a master's degree in healthcare management. Now, my VA career spanned from December 1983 to when I retired in January of 2021. The first 11 years were spent at the Northport VA Medical Center on Long Island. And then I transferred here to the Atlanta VA in January of 2021. I spent a good part of my VA career in the clinical laboratory. And then in 2009, I was moved up into administration, where I spent the rest of my career in compliance and business integrity. It is vital that a TS woman learns from an early age to be an advocate for her own health care. This is not to imply that she tells the clinician how to treat her, but it is vital that there is a strong dialogue between her and her provider. This can be started from an early age, making age-appropriate decisions. For instance, what color Band-Aid would you like if this child is a toddler? That may seem trivial, but at age 50, I was asked, what type of heart valve do you want? See how that works? I once walked into an endocrinologist's office back in the 1980s, and when I mentioned that I had Turner syndrome, he literally opened up a textbook. Now, that's fine. I'm not complaining about that. But what I'm saying, that's yet another example where a Turner woman has to be used to advocating for their own health care and work together with their provider. It's important that a provider be familiar with Turner syndrome. My mother took me at age 16 in 1977 to the OB/GYN that delivered me. He did an internal exam and sent me home saying I was just a late bloomer. He apparently was not familiar with what streaked ovaries felt like on palpation. I wish he had at least enough questions in his mind that he would have sent me to a specialist. I went undiagnosed for another year. I am seen in the Emory Adult Congenital Heart Center. But what's interesting is pediatric cardiologists do regular rotations through that clinic. This is wonderful because it helps them look forward with their decision making and see how it may affect someone years down the road. I think it's important that a Turner woman maintain a healthy weight. I also think it's important that a Turner woman keeps fit and active. And I'd like to add, I'm still willing to come see you all in person. If that can be worked out, I'm very happy. Even if it's part of another class and I just show up for a minute or two, I don't care, that's fine. I would love for you to see me in person and for me to get to meet you. I again thank you for this time that you've allowed me to come and present my story. It occurred to me that I never said anything about what type of heart valve I had installed. Well, I am still rocking a bovine aortic heart valve installed in 2011. Also, you may have been wondering who finally diagnosed me. It was a reproductive endocrinologist at Long Island Jewish Medical Center on Long Island. Of course, he did all the hormone studies, both blood and urine, to confirm everything. I am so thankful to have been here with you today, even if it is virtually. Please do not hesitate to reach out to me if you have any questions. That is what awareness is all about. My email address is cindykenward@gmail.com. CINDYKENWARD@gmail.com. And please, thank you again for taking the time to watch my video, and I hope I can help. I hope I can help with awareness. Thank you.